Hello Sanjeev, tell me a little bit about yourself and My Health UK, which you created.
Hi Veronica, yes, I'm a GP, been a GP for the last 12 years in Blackpool, and been developing a product which is called My Health UK over the past 2 years, which essentially is a digital platform created for primary care with a patient-facing app to activate patients.
And what sparked this development?
The main reason for looking to develop something like this is, over the years, working as a GP, there's been a lot of changes in primary care and a lot of difficulties in terms of addressing capacity. And My Health UK was designed to help to address those needs in primary care by giving clinicians a platform to engage with patients, but at the same time activating patients to encourage self-care, to help address some of the challenges facing primary care, which is capacity and demand.
So are there any other digital solutions other than My Health UK?
Yes, they are digital platforms that have been adopted in primary care, but we still are faced with the same challenges addressing capacity and demand.
And so does My Health UK address those challenges? Tell me more about the ins and outs of your approach.
I think one of the key things for developing a digital platform was not to duplicate services that are already in existence. So we created a very modular platform that addresses needs that are currently facing primary care. And firstly, to activate patients, to encourage self-care. The second big challenge is to help address capacity. And the way we've done that is by helping to reduce DNAs, by providing new modes of consultation so patients can access, giving clinicians the opportunity to manage patients more effectively through our remote monitoring solution. Take, for example, one of the platforms we created, which is community care. At present, we call it the home visit challenge. GPs spend a lot of time having to visit patients in care homes and nursing homes, and we've created a unique solution to help address that, where clinicians can safely manage patients and reduce the number of home visits and spend more time in clinical care.
Walk me through an example. If I was a GP and I was looking after someone in a care home, how would I use My Health UK with that patient?
I mean, talking about our community care model, which is one aspect of what our solution provides, we've created the solution to give clinicians control over which patients they want to monitor in the community. So for example, if I have a patient in a particular care setting that's a high demand patient requiring a lot of home visits, I could enable that patient to be monitored remotely in the care home by selecting a set of vitals that are appropriate to that patient. If the care staff then needed an assessment of that patient, they would be able to submit me the vitals, including a secure message and also an image of the patient if needed, if it was appropriate, for the clinician then to review that on My Health UK platform, make an informed decision, communicate back to the care home with advice and a treatment plan, but also giving the care home more information about the patient that would help improve the care. So the clinician can submit a care plan, can submit a discharge summary, any relevant information they feel may help improve the care of that patient in the care setting. And hopefully, by doing that, reduce the number of unnecessary home visits.
Sanjeev, that sounds amazing. It sounds like something which the NHS needs in order to transform itself. Have you come across any barriers or challenges facing the adoption of My Health UK?
As a clinician, creating a product without giving a thought about how we're going to roll out and move forward. I think you're always faced with challenges. I think the biggest challenge with any clinician developing a product is trying to get the message out as to what your product's about, and getting an opportunity to trial it in even a small setting. And that takes a lot of time and effort and resources to be able to achieve that. The other barrier, I think, in the NHS is to adopting technology is the concern about the cost of using new technology. And that is one of the main things I've focused on, to create a cost-effective solution that encompasses a lot of technologies into one product, but making it so that it's a modular system that can be adopted independently depending on where the need was. And as I gave you the example, looking at the community care model to help address the home visit challenge for GPs, it's a standalone product within My Health UK that can be adopted on its own without any of the other features that the product has to offer. And I think the NHS has to look at solutions like that to transform the way it currently adopts technology and to become more sustainable in the future.
So tell me about the adoption of My Health UK locally and what your vision is for more national adoption.
We've been fortunate. It's been commissioned by Blackpool CCG. So we have rolled out to practices in Blackpool. We've also been fortunate to be part of a INR remote monitoring project in East Lancashire. And that started in June of this year. So that's where we're up to at this stage. The next opportunity for me would hopefully, I would like to see My Health UK adopted maybe at a wider local level, say Lancashire, in the near future. At the moment, we are collecting a lot of data and evidence to show how the product is being used at practice level and to obviously show benefit.